Today we are going to discuss Chapter 12. Chapter 12 is Dental Service and Coding. Okay, so there are four conditions that requires treatment, such as tooth decay, any tissue, meaning like periodontal disease, any tissue that is infected, or there's an inflammation or any cysts, tumor, things like that. Also, a turmeric to the tooth, which includes, loss of the teeth and any tooth structure, bone loss, things like that. Also, the development of the disease, such as a cyst, as I said earlier, a tumor or abscess. Okay, if you have an abscess, some way, shape, or form, it needs to be treated with a form of antibiotics. And then we will, once the antibiotics proceeds to cure the infection, that'll determine what we can do next. Do we put a filling? Do we extract the tooth? Do we get a root canal? Implants? Things of that nature. Do we have to go to oral surgery and remove the tooth? So that's your four conditions. Make sure you highlight that. Next, it gets into the different types of dental service performed. Now, when you're going to be to your computer, you're going to be, whether you're on the computer or doing paper work, you're going to have to know these different codes. So, for example, as we went over the different forms that we use to submit a claim, the first one says diagnosis. So all your codes from D0100 to D0999 will fall under a routine service, such as planning the required treatment. So, when your patient comes in with an issue, we absolutely have to come up with a plan of treatment to treat that patient. So you would put this code for the insurance on the insurance form, the patient's insurance form. Preventive, that's more of your cleanings, group panning and scaling, perio probing, sealants, any preventive methods that a patient can receive to help with, how can I put it? To help with a preventive method to not allow any tooth decay or any trauma to the teeth. It's a preventive methods to prevent any trauma to the teeth. Okay. So that's your routine design. Like I said, to prevent decay, periodontal disease. You need your cleanings. You need to floss every day to prevent periodontal disease, gingivitis, things like that. And also to educate your patient on how to take care of the dental structure before a disease even occurs. Now, it goes into some more of your types of dental treatment. I want you to go ahead and make sure you highlight all the different treatments, restorative and the code, endo and the code, periodontist and the code. We know that endo is any treatment that's done to the pulp, which is the nerve inside of the tooth. Restorative is where we're pretty much restoring the tooth, whether it be a crown, to give that tooth structure back, any fillings, composites, amalgams, things of that nature, bridges. Periodontist, that's pretty much where they're going to be treating the tissue that surrounds the tooth and support. So remember, your teeth are surrounded by around gums, but under the gums there's bone that actually allows the teeth to stay in place. So without the bones, if you didn't have bone inside of your arch, whether it be the max or the man, when you would bite into an apple, your teeth would pretty much splat out like piano keys. So it wouldn't give your teeth any stability to latch on an apple and bite it apart. So we're going to move on to the next slide and make sure you highlight the different services. Okay, here on this slide, it talks about any of your removable appliances, any of your prosthodontic appliances, you would use these codes, and it just symbolizes any replacements of the natural teeth from a removable appliance. So think about the things that you could actually put in your mouth and remove. So we know any form or shape of denture, that's an appliance that can give you a natural tooth structure, but we know we have to take it in and out to clean. Same as a partial, same as a flexible partial. Anything that's not permanently cemented in the mouth. Okay. Now, when you get into your maxillofacial prosthesis, that's kind of a comparison to your experience with an orthodontist. So, when we get into the maxillofacial, that's when they use that part to detect any defects that would possibly be in the head or the neck of the face. So, for example, if your patient is overcrowded, let's say we have a crooked smile, things of that nature. Once we do receive, once we do receive those braces, and it pretty much pushes all the teeth back in the correct spot, that is a form of us detecting the error and fixing the error. Okay. Okay, moving on, please make sure you highlight. You will need to know these service performed and the codes. Okay, here are some more codes. Your implants. That's any artificial tooth that is replaced into the jaw bone. Um, you know, it's a more of expensive method, but if your patient has good bone support and they're willing to go through the process and pay, the tens of thousands of dollars to get the implants, then that's great also. Um, Next is another form of your prosthetics fix. And that is, it's a little different when you get into the fixed part because the replacement, of course, replaces the natural teeth, but it's a more of a permanent appliances. Okay, so like I said, when you see the word fix, that means the appliance is going to be permanently cemented in the patient's mouth, such as a crown, a bridge, implant could possibly fall in that area, things like that. So pretty much any type of appliances that we would use a permanent type of cement to actually place that in the patient's mouth. And we all know ortho is a form of correction and prevention of poor misalignment teeth. Everyone wants straight teeth. Okay, moving on. Here's some more types. You have your oral maxillofacial surgery, and that's where you would go in for any treatment for the internal structure of the mouth to try to um, limit the dental structure and the supportive tissue that's around each tooth. Okay, so for example, wisdom teeth would fall in that area. So any general services, whether it be a miscellaneous service, any type of treatment that's not listed any elsewhere. So think about when we're charting on Dentrix and your patient may possibly have a hairline fracture, but nothing's wrong with the tooth. We want to go ahead and chart that so we can keep a watch out for that miscellaneous hairline fracture, things of that nature, like staining but no cavity, things like that. Now, your common diagnosis procedures, we know that anytime your patient comes in, I don't care what type of dentist they go and see, whether it be general, oral surgery, endo, um, periodontist, um, even even orthodontist, we definitely have to do a clinical oral examination on the patient. That falls into one, actually looking in the patient's mouth after taking x-rays and pictures to properly see what's going on in the patient's mouth. And then if we find anything abnormal, of course we need to test it. Any oral pathologies, we're going to have to send to the lab, things like that. So that's the only way we can properly diagnose patients. Okay, so as I said earlier, your preventive services would be a dental prophylactic, which is your cleaning, your annual cleanings, which would be every 6 months, or if you need, every 3 months. Um, A topical fluoride treatment is a preventive method. It helps the teeth become strong and it prevents cavities. Sealants is another preventive method. That's where we take a little composite and place it into the grooves of the teeth. Well, when your patient has deep grooves, the doctor will go ahead and clean it out and place a sealant to prevent any sugarish things, food, things of that nature to get stuck in that deep groove. And then you have your space maintainer, which is normally used on children. So, for example, if we had a child that came in and let's say they fell and they crack I don't know, S. Okay. So they crack tooth S. So we have to pull it out. Okay. So what we would do is we would place a space maintainer between T and R to maintain the space where S was so that none of the teeth shift and prevent that permanent tooth for coming out. So remember, I always say your teeth are like sister and brother. You need one and the other. So if you pull one, they don't know, they're looking for another brother or sister to lean against. So they're going to shift forward or shift backwards or make these weird spaces and make your teeth crooked. So the space maintainer prevents all those issues. Okay. Another one is your restorative service. As I said earlier, that's your fillings, inlays, and onlays and crowns. Fillings could possibly fall between composites and amalgams. Inlays, that's inlays and onlays is a porcelain filling, and your crown is what actually covers the entire crown of the tooth. So you may see sometimes people, adults, they'll smile, they may have a big silver or gold crown on a tooth. That's what it's symbolizing. Endo, we know that anytime the tooth has um, issues in the pulp, we definitely have to, and the pulp is a fancy way of saying the nerve in the tooth canal. Um, that's when we have to go in and remove that pulp and do some type of therapy to revitalize that tooth. Um, you know, we want all our patients to absolutely keep their natural teeth, but sometimes it's just out of our control, and we have to do a root canal in order for them to save the tooth. Now, if you're going to do a root canal on a tooth, we're going to remove the dead tissue, which is the dead pulp, out of the tooth. We're going to seal it off with the gutta percha, and you absolutely have to put a crown on that tooth, because if the heart of the tooth is dead, then it really becomes just a shell. Okay. Periodontist service, we know that that's all the surrounding gingival margin, the grooves, the tissue, um, the sealant area, the root debridement, things like that. When we have to do any procedures where we either have to trim the tissue, clean under the tissue, provide a mouth guard, just to fabricate that whole area. Okay, that's what you would do periodontist service for. And of course, if you lose any of your bone or tissue, we can sometimes replace it and put artificial bone and tissue, but some cases we can't do that. Okay, your common removable periodontist service, of course, like I said earlier, that's your full and complete denture and your partials, any rebase, things of that nature. So removable. Remember the one earlier said prosthodontics fix, that's permanent. Here, prosthodontic removable, that's your removable appliances. Maxillofacial, excuse me, that comes into any extra oral prosthesis or any intraoral prosthesis. Remember, that's where we're pretty much detecting any malfunctions between the head and the neck. Okay. Next is your common implants service. Remember, implants is a process. You have your sub periosteal implants. It's different implants that you can actually go through. And we will talk a little bit more about that. I will provide some videos on exactly how to break an implant down. Okay. And as before, we talked about the prosthodontic fix. You have your ponics, retainers. When you say ponic, that's just like a porcelain tooth that's pretty much just cemented. It's kind of like a tooth, a dummy tooth with two wings where you place between two teeth that's missing. Fixed bridge, things like that. All right. Now, as I said before, your oral maxillofacial surgery, that's dental surgery, oral surgery, any impacted wisdom teeth that has to remove, surgical extraction, root extraction, fistula closure, things of that nature. Okay. It also continues on to any biopsies and surgical incisions and things of that nature where you have to be under to pretty much treat any fracture, dislocation, any trauma, wounds, things like that. You would go to the oral surgeon. All right, and we all know ortho. That's your where you pretty much go to reposition your teeth. Okay. Sometimes with oral surgery, you have to extract some of the teeth, and some teeth have to get crowns on them. It's just kind of the way the cookie crumbles sometimes. All right. So your general services, that's drugs that you may receive, like, antibiotics, pain meds. That's your general services is who you go to first before you can actually go to an orthodontist or see any of your specialists, your endodontist. Okay. You have to get a professional consultation to see how to proceed to the next step. And some of these procedures your general dentist can actually perform, and some they can't. You absolutely have to go and see a specialist.